what's in your mouth really impacts the rest of your body. Not just, oh, we're not only worried about cavities. Of course, we don't want cavities. What we're worried about is why we're getting these cavities, what's causing these cavities, and that happens a lot during pregnancy, but also how it's impacting, I'm going to stick to the pregnancy, how it's impacting our baby. So when our biome is off, that's what we're passing on to our child. So our children get their microbiomes from us, and also premature labor and lower birth weights have been linked to severe gingivitis and periodontal disease.
Dr. Leedia, oh my gosh, thank you so much for coming on the Root Cause Medicine podcast. I'm finally interviewing you and I can't wait.
Thank you. It's an honor to be here.
Well, we are going to talk about, honestly, all things holistic dentistry, which is right in your wheelhouse, but very specific for women, because as I dive into women's hormones and oral health, I mean, you've honestly taught me a lot. It turns out that changes. Hormones really can have a huge effect on our teeth and our gums and our microbiome. And yet nobody other than, you and a handful of others, nobody's talking about it. OBGYNs aren't talking about it. No one's mentioning oral health as part of, an HRT, getting older, over 40 crowd type of scenario. And that's what I want to talk about, because I think a lot of women don't realize how critical oral health, mouth health is as they make this transition.
100%. And it's my dream to build that bridge between dentists and our medical counterparts, whether you're a dietitian or an OBGYN or anybody who's working with women. So thank you for helping me spread that message. But hormones don't discriminate. And let's get into this is a root cause sort of podcast, right? And there is an embryological, there is a fascial component, and there is a stress response between your womb and your vagina. So we have the same sort of oral tissues. So oral tissues are very similar to vaginal tissues. And why? Because they stem from the same embryological layer. So that's just like a root cause of why there's just so many similarities. And I dug in deep into this after I moved to Aramco, which is the biggest oil company in the world. And because I spoke Arabic and I was American trained, I saw all the women there because they wanted female practitioners. And I saw all the American expats as well. And that was before I was married, kids, anything, right? And I just saw destroyed mouth after mouth after mouth after mouth in the women. And the men, not so much. Like there was, of course, an opportunity for better hygiene and just education about oral health, but the women it was really bad. So that's when like something started like ticking in me. I was like, gosh, like this is really weird. What is it? And they don't teach you any of this in dental school. So fast forward to my pregnancy. My first pregnancy, I had hyperemesis gravidarum and I lost my front implant right here. And I went from being this thriving, energetic, independent woman to literally bedridden, vomiting 7 to 14 times a day. And I got really depressed postpartum with Julia, and I lost that tooth. And it was pre-mask, so like I didn't hide it with any. I just rocked it. I was like walking around toothless, and I dug deep. It was a very hard time for me in my life. And long and behold, over 65% of pregnant women, 65% of women encounter dental dis-ease during or after their pregnancy. That's absurd. So I'm like, why? Like I kept digging in. Why? So then I thought of my time in Aramco, and then I thought of like my pregnancy, and I dug deep in. And when they stem from the same embryological layer, our mucosa is the same, they heal the same, and they have estrogen receptors, progesterone receptors, and around our periodontal ligaments, we have relaxin, which is a hormone that is very necessary for normal childbirth. If you want to give birth vaginally, you need that relaxant to relax all your ligaments. But hormones don't discriminate. And we have relaxin receptors around each one of our teeth, like each tooth is housed in a ligament. And that's why a lot of women, their teeth move, especially with consecutive pregnancies. It's the relaxin, it's the clenching and grinding as well that happens with you asked me how I'm doing, with this lack of sleep and all that. But hormones really matter. And in our mucosa, our oral mucosa, there's estrogen and progesterone receptors. So if I'm not pregnant and you're pregnant, the same food that we eat, they're going to impact you differently than me because of the difference in our hormones. Because progesterone and estrogen make us a lot more sensitive and a lot more reactive to the plaque that we have in our mouth. And there's something called pregnancy gingivitis that, if left untreated, gets into the irreversible, which is what happens with a lot of women. It becomes periodontitis. So gingivitis is reversible, periodontitis is irreversible, and then it starts compromising the bone structure around your teeth, and you get premature tooth loss. And that's not even going to talk about how it impacts your baby as well. So I can interrupt me with questions. It's just like, I'm so passionate about this.
I think this is a great place to start. It'll start with what happens with pregnancy, because obviously it's so common. Oh my gosh, over 65%. And then, we'll kind of move to the next phase of life. Same questions, but different age group for those women, because of course, the decline in estrogen and progesterone is affecting those women as well. But if we stick still with the women who are pregnant or immediately postpartum, give me common symptoms. If somebody's listening to this going, I'm pregnant, or I had multiple childbirth, like subsequent, like right after the other, it's definitely affected my teeth, I can tell. What are they experiencing?
Such a great question. Symptoms: bad breath, because you're more likely to mouth breathe during your pregnancy because of something also called pregnancy rhinitis. Because of the increase in, I always say nasal hygiene is as important as oral hygiene. Yeah, I'm a dentist, but I talk to all my patients about cleaning their nose and making sure that their nasal passages are patent for you to get a proper breath. If you're not breathing through your nose, you're not thriving. So that's like just bottom line. So pregnancy rhinitis, because of the pregnancy rhinitis, due to the increase in estrogen, they tend to mouth breathe more. So I get, I have more dry mouth. Oh, I have bad breath. I feel like I have a weird taste in my mouth. They get more cavities. They get more recession, because when your gums are drying out, that recession is one of the consequences. Couple that with improper brushing, clenching and grinding from the stresses of being pregnant and postpartum. Cavities, I had a patient come back 3 years later. She disappeared for 3 years. She had 2 kids in those 3 years. She came back with 6 cavities. And it's very common along the gum line, because that's the number one area. Like, we don't brush well when we're pregnant, me included. So I was getting dental cleanings every month to avoid all of these symptoms. And I got recession only on 2 teeth, and I feel it would have been on like 10 teeth had I not been very careful. And then, bleeding gums and sensitive teeth. Those, I would say, are the teeth-wise, dental-wise. And also another thing that I get often, TMJ starts to flare up because of that increase in estrogen and the increase of impact on the jaw if you're clenching or grinding at night. Yeah, and that's it. That's like, those are the main things. Mom of 3 brain. But yeah.
It seems like these things could also impact, obviously, if you're impacting the oral microbiome, everything going on, and then you swallow it. So not only do you have all this oral, mouth, teeth, gum issue, you just swallow it right down to your stomach and into your intestines. So it seems like it would just also lead to potential stomach issues and intestinal issues as well.
100%. Oral dysbiosis is linked with gut dysbiosis. And one of the main tests that I've been loving in my office is an oral DNA test that shows me the quantities and the presence of the main dysbiotic bacteria in our mouth. We have tons of bacteria, of course, in our mouth, but there are a few that are linked to certain diseases, that are linked to premature labor, lower birth weights, P. gingivalis, TN, and TD. I lost the name, but those 2, one of them is linked to oral gut cancers, colon cancers. It just came out. This is an article that came out like a month ago. We can share it with our listeners. But what's in your mouth really impacts the rest of your body. Not just, we're not only worried about cavities. Of course, we don't want cavities. What we're worried about is why we're getting these cavities, what's causing these cavities, and that happens a lot during pregnancy, but also how it's impacting, I'm going to stick to the pregnancy, how it's impacting our baby. So when our biome is off, that's what we're passing on to our child. So our children get their microbiomes from us, and also premature labor and lower birth weights have been linked to severe gingivitis and periodontal disease.
I didn't know that.
Yes. So it goes a lot. We are so connected. Like, these hormones So when you're mouth breathing due to pregnancy rhinitis, your microbiome is going to become, the homeostasis is going to be out of the window. So know that dysbiosis I think we get 40, don't quote me on this, but 40 to 60% of our gut microbiome comes from our mouth. Like, if you have a cavity, there's no way you can have good gut health. If your gums are bleeding, you already have leaky gums and you have leaky gut. It makes sense. You don't even need to be a dentist or a doctor. It's just, this isn't talked about it's not talked about enough. So I always talk about the transitions of life in a woman, for a woman, puberty. Then a lot of women are getting their eggs, like egg freezing, IVF, IUIs. So these are all external hormonal insults to our bodies. And then you have pregnancy and postpartum. And then you have perimenopause and menopause. And each one of these transitions has very impactful oral implications. And we really need to take care of each other, and we need to share this with women, because if your gums are bleeding, that's not normal. So think of a teenage girl, like a 13-year-old, like she has her period or is about to get her period. And what do a lot of teenagers do? They get braces. They get very self-conscious. Are they eating well? I don't know. When I moved to America, I saw the vending machines here. They're eating Cheetos. And I mean, I think there's more of an awareness now and people are being a little more conscientious, but we need to get everybody on board. We need to get the teachers, the schools to support our female, during this age range. And then they're getting their periods, which is a flood of hormones, right? Especially for the first times of their lives. I'm seeing this all the time in my clinic. I don't see as many kids anymore, but lots of gingivitis, and starting right there. So if you nip it in the butt there and you do your thing there with these beautiful girls, they're not going to suffer later on. They're not going to be suffering from cavities when they get their braces off. They're not going to be suffering from severe periodontitis, because of gingivitis. It's very reversible when you're that young. A few years later, we're getting married later. We're having children later. So I have a friend, she went through, a patient who's become a friend, 20 rounds of IVF, and she got her miracle baby. But that's a lot of hormones. So no one ever tells you that between each round of IVF, you should get yourself checked and at least a cleaning, a dental. Like, the beautiful thing here is that the solutions are very simple, but the solutions, when the problem arises, it becomes a lot more complex and also a lot pricier.
Is it different between teenagers and pregnant? Like, would you tell a mom or to, how to coach their teen daughter? Or if you see the teen daughter, do you coach them differently than you would say you've got a pregnant mom or a recently postpartum mom who's come in to see you?
So I feel like with the pregnant moms, they're easier to coach and speak to because they have their baby. So they care a lot about their baby. You shift once you are carrying life, especially I lost one of my babies. I was pregnant with twins. So then afterwards, I became very vigilant. People who've encountered like miscarriages and abortions, they know the value when they get pregnant. So they're more, how do you say it? They're easier to coach, versus when you're a teenager and all those psycho-emotional things that are happening, you got to get down to their level. So I love working with teens because I connect with them, because I wish I had somebody connecting with me. I was like too scared to tell my mom about my period. Like, that's where we were, right? But I talk about bad breath that matters to them. So you gotta talk their language. When you say bad breath to a teenage girl, she's going to be motivated. Motivation. That's the word that I'm looking for. Pregnant women are very motivated. Teenagers are less motivated. And then I show them pictures of cavities that occur after braces removal or even Invisalign removal. And they don't want that. And then I talk to them about the future a little bit. I plant that seed, but I focus on cavities and bad breath because that's what matters to them now. So the way I coach a mom with a teenage daughter is I do tell her I would recommend dental cleanings and checkups every 3 months max, especially if they have braces. And find a dentist that your daughter feels comfortable with. If your daughter doesn't feel comfortable with her dentist, there's a huge emotional component to dentistry and to women going to dentists. And I think it is because of that oral womb connection. There's a lot of emotion connected. Our fascia starts in our mouth and ends in our pelvis. So when we're stressed, everything is stressed. And in childbirth, I remember my doula was like, she's like, open your mouth and relax. Because when you're relaxed up here, you're relaxed down here. And so it's very important to not only meet our teenagers at their level, but also educate them in a very non-judgmental and accepting way. And they need to feel comfortable with you as their practitioner for them to be receptive.
Absolutely. Now let's go to the other end before we get in, of course, heavy detail on what to do. Now she's over 40. Now she's hit the perimenopause, or maybe she's fully postmenopausal listening to this. Her hormones went haywire for a bit. Now they're low. She's considering hormone replacement. Maybe she's on hormone replacement. Maybe she's not. Regardless, she's in this big transition again, as you mentioned. And I feel we're getting more and more knowledge around watch your mouth, watch your teeth, go to the dentist at this stage, be extra careful because things start to fall apart again. And it sounds like that's the truth. Unfortunately.
It is the truth. Yeah. So perimenopause and menopause are some of my favorite group of women to work with, because you can have a lot of improvement with them because of all the changes that happen in their body. All women, I love to work with everybody, but I feel it's just more impactful there because less people are talking about it. So when you have that drop of progesterone and that drop of estrogen, your collagen production is compromised. So your mucosa becomes a lot more dry and a lot less elastic, right? And a lot more loose. And then your salivary flow. So estrogen impacts not only how much saliva we're producing. So you're dry down there during that time. You're also dry up here during that time. Why is that? Because estrogen impacts our salivary gland, salivary production, not only the quantity, but also the quality. So that's why it's so important if you're in perimenopause and menopause, you're really eating that balanced diet. You're really not eating the sugar and any sort of food allergen that can impact your body to cause inflammation. And you're focused on hydration with proper electrolytes, not just any hydration. You really need to focus on hydration because you're super duper dry. So you have less salivary flow. And when you have less salivary flow, dysbiosis goes crazy. And I see the gut health goes like a lot of gut issues, a lot of autoimmune issues start during that phase. It's just like your body, it's like self-destruct, but there are solutions and there are things that you can do to make that transition better. But if you have dry mouth, that is the most important thing that you want to nip in the butt, or at least start to, sometimes you can't nip it in the butt right away. Like it's a process. But there's also burning mouth syndrome in perimenopausal and menopausal women, dry mouth, burning mouth syndrome, and tonsil stones, like sudden tonsil stones, and bad breath. And then sometimes, this isn't very common, but like a weird metallic taste in your mouth.
I've heard that.
Yes. And of course, the cavities and the gum disease, that's the typical things, but those are very specific to menopausal women.
I want to go back to the burning mouth because that one doesn't get discussed, but yet whenever I bring it up on social media, the comments just explode. So I know it's more common than we think. How often do you see, or what percent would you guess of the women of that age experience? Well, first of all, explain burning mouth. And then what percentage do you think you see?
Burning mouth is exactly like what it's describing. Like you literally feel like your tongue is on fire. Like your mouth feels very uncomfortable and it just doesn't feel good at all. And so I have a theory that hasn't been scientifically proven after seeing women for year after year for many years. There's emotional and psychological feelings in our nervous system that when we get to certain transitions, they flare up. What do I mean by that? Like, for example, me, I've had my third pregnancy, and with each pregnancy, trauma from everybody has some sort of trauma. My trauma is not more important than yours and vice versa, right? Some people have just more higher quantity. It just starts surfacing to the top. Why do a lot of women over 40 get autoimmune conditions? So I had this woman, she's gorgeous. She kind of looks like you. She looks like you and Reese Witherspoon. She's like in between, okay? She came in on Friday. I'm not actively seeing patients yet, but I'll see exams. Like I'm not doing dentistry yet. She had a child, bless him. He had a brain tumor. He had to go through a lot of surgeries as a 5-year-old, a 6-year-old, 7-year-old. So she was in give mode. Of course, your child's, and it's for the first time in her life, she's like resting after like 10 years. And she came in, she's like, I feel unwell in my mouth. She's like, I feel my whole mouth is burning. She's in the perimenopausal stage. So I got this new machine. It's an energy machine called the Biocharger. It has PMF, voltage, sound, frequency healing. So I'm like, I've seen this happen to where a woman has gone to a dentist and she's come out like with 3 or 4 root canals because she was in pain everywhere. I will not touch you if you're in pain everywhere. I need to see where that source of that pain. And for her, I knew there was an emotional component, like huge emotional component. So I was like, this weekend, you're going to do XYZ. You're going to do this biocharger session 3 days in a row. After the second day, I swear to God, she texted me back. She's like, it's so weird. I feel a little better. Like, it's not as intense, the burning. I know that's not very scientific, but what I'm trying to say, there's a huge hidden emotional connection to the severity of our symptoms and what manifests in our mouth. And that's why I love oral health and I love mouth, because it really tells me your story. I can tell a lot about your life just by looking at your gums and your teeth. And I hope I answered your question. But yeah, but burning mouth syndrome, yes. So vitamin Bs help a lot with that. What percentage? I would say maybe 30%, 25 to 30%. It's a significant amount, but not predominant. But yeah, I have that. I have a menopausal questionnaire that I give every woman in that age range. And I'd say about 25 to 35% of women click that.
And it's not forever. Does it go away?
It does go away. It should go away. If it doesn't go away, then we get a team of specialists involved and we see how to mitigate it. It's just very important with this age group not to be very aggressive with treatment, because they're going through a massive hormonal shift. Like their body, there's no stability in the body. And the reason I'm emphasizing this is because I've seen way too much irreversible dental treatment, like crowns and root canals being done. And then the problem still isn't solved at the end because it's something like a vitamin deficiency, or it's something emotional, or you got to let it take its course, let the hormones level out, and then let's see how you're feeling.
Can you tell the difference between a woman who's on hormone therapy versus a woman who's not on hormone therapy if she's postmenopausal?
So very little research is done on that. I haven't seen enough women on hormone therapy to make a comment on that. But the little research that's out there, the very little research, and there needs to be way more research on that. And I hope to be part of a research project very soon focusing on that, shows that women that are undergoing hormone replacement therapy have less symptoms, dental symptoms, while they're going through menopause and perimenopause. Yeah. So the propensity of dry mouth and burning mouth syndrome and weird dysphagia, and that's it is less. But is it significant research? Not yet.
All right. Well, now, of course, I have to ask you, like, what do we do? Where do you start? What is everything from the teenager all the way up? Is it the same recommendations? Is it slightly different recommendations? So I want to get into the basics of oral care.
I love it. What do we do? There's a lot that we can do. There's a lot of hope. Like, I know when you're going through these transitions, it's very difficult. For example, I'm going to go through each transition because it's the same but different. So with our teenagers, if I'm going to sit there and lecture her about her diet, I'm going to lose her. If I'm going to tell her that she needs to floss every single day while she has braces, I'm going to lose her because that's too much for her. So for teenagers, I ask them, say, like, can you floss for me twice a week? And then use the water pick the rest of the time. If they are a little more health conscientious and into it, I'll tell them, oh, can you oil pull? Oil pulling is great because it just helps remove the bad bacteria and you spit it out.
Can you explain oil pulling for people who don't know?
Oil pulling is an Ayurvedic practice where you take a teaspoonful of coconut oil and you swish it. And so because it's an oil, it's going to draw in hydrophobic bacteria. Okay. And the hydrophobic bacteria, which is the type of bacteria that doesn't like water, it's going to be attracted to the oil. So it's going to pull the hydrophobic bacteria, and that bacteria is usually causes dysbiosis. So you're cleaning up your mouth. And I always tell people, don't spit that, not in the sink, because you don't want all that gunk in your sink, especially if you're going to be doing it often. We talk about flossing. We talk about oral care a lot. I also mentioned that the better she cleans, more white your teeth will stay. You won't have staining. I lure her in that way. And then the next time she comes, I don't let her, if you're in braces and you're a teenager, I want to see you every 2 months until your braces are off. Because one of the most common symptoms once they get their braces removed are numerous cavities around where the brackets were. And that is no fun. That is a recipe for trauma. That is a recipe for very high bills, trauma, and it's a recipe to hate your dentist. So that's what it's like. There's a huge emotional connection component to the teenagers. You got to win them over, as in anything, that you're trying to do with them, right? For IVF and egg freezing, after every single round of retrieval or implantation, get a cleaning. At least get a cleaning. Just keep that oral microbiome in check, the oral bacteria in check. One big thing is that our mouth is one of the number one sources of inflammation in our body. It's a very low-hanging fruit if you have any sort of chronic condition, metabolic disease. It just adds insult to injury. So if you're going through fertility issues, get your mouth checked. Research shows it takes 3 months longer to conceive if you have dental issues. And I know this is focused on women, but for the men, if they have periodontal disease, there is higher levels of apoptosis of the sperm. So there's lower sperm counts and lower sperm motility.
Interesting.
It's incredible. I had this one guy. I don't see very many men. My brother sees all the men in my practice. And there was this one guy and they're trying to conceive. I see his partner and Rashad sees him. And I was like, I want to take an oral DNA test. They've been trying to conceive for like 3 years. And he is high on every single dysbiotic bacteria. So I'm so curious to see what will happen after we change that. I've seen wonders on the female side, but no one does research also on the men for that. Like it takes two to conceive, like you need both.
Absolutely.
Right? After every round of egg freezing or IVF, whether it's implantation or egg retrieval, I recommend getting your gums cleaned and your teeth checked. Just, and of course, diet really, really matters. Good protein, whole foods, and supplementation really makes a difference. I feel one of the main reasons why I'm in a much better position after this pregnancy in all ways is because I'm consistently supplementing from a great brand that I love. And I didn't lose as much hair. I didn't have as much tooth sensitivity. There's just so much that happened differently when you're taking care of yourself in other ways that do show up in your mouth.
Now, when you say supplementing, because everyone's going to ask, well, what supplements are you taking? What are you referring or alluding to?
I take Wenatal. It's a prenatal brand. I love it because it's only 3 capsules. I don't like to swallow pills. I have 3 kids, a business, a husband who's like 2 kids sometimes. So it's very hard to take care of yourself in the season that I'm in. We've tried to do this for I think 4 times. This is our 4th attempt. So life gets really busy. So the more simplified things are, the more likely you're going to do them. Right? So I really love this. And their dosages are high enough. And then I do take an additional magnesium from BioOptimizers. Great brand. I love their magnesium. And I also take omega-3 fatty acids. That's super important. And as just a very light detox that is very safe in pregnancy and postpartum, I take chlorella pills. You can take chlorella water, spirulina, chlorella. You can put that in your smoothie. But that's just really nice, a very gentle detox for your body to lessen the burden. And what else do I take? That's pretty much what I take consistently. Oh, and I take Heart and Soil organ meat supplements. And I think the Wenatal and that have been responsible for me not losing much hair in this postpartum season. My first 2 children, I didn't take as good care of myself, and I lost a lot of hair. Like you could see significant hair loss, especially here. And that's really depressing for a woman. It doesn't feel good. It hits your confidence. It hits the way you show up in the world. It hits the way you parent if you're a parent, or the way you are with your partner, and the way you are with yourself. Like all the self-deprecating thoughts start going through your head every time you look at the mirror. And we need less of that. But that's what I've been taking consistently, and I love it.
I love that. Okay. Now let's say you're talking with somebody who is actively pregnant. Oral care, does it change?
Yes. When you're pregnant, you're pretty tired. So your oral care goes a little bit astray, especially during the first trimester madness of the morning sickness, which isn't limited to the morning, right? For those who are nauseous, I tell them to get baby toothbrushes because that will decrease the nausea and the gag reflex. That's helped a lot of women in my practice, just that little tip. Find a toothpaste that you can tolerate. A lot of pregnant women, especially during that first. So during the first trimester, they need a lot of support. But the biggest thing for pregnant women is to be mindful of what they're snacking. Of course, snack and enjoy, please, whatever can curb that nausea. But if you're snacking on saltine crackers, that is worse than candy for your teeth because it doesn't show, it sticks and it's very sticky on your teeth. So I was getting dental cleanings every month to 2 months. And I think that's the reason why I didn't get any cavities during my pregnancy. It's 100%, not I think, because I wasn't eating very well my first trimester. And I was drinking a lot of carbonated beverages to curb my nausea. And I was falling asleep many nights on the couch without brushing and flossing. It's a recipe for disaster. And then when I did brush and floss, I could only brush my front teeth properly. Not everybody goes through what I did and went through. I had really severe I was bedridden. It was very bad. But just being mindful of that you and honoring yourself that you are building a human and you are very tired. So an extra trip or two to the dentist during your pregnancy is only going to help and not hurt.
And do most dentists know this? If somebody's pregnant and goes to a dentist and says, "Yay, I'm pregnant. I'd like to start coming more often," or "I feel I, of course, should come more than every 6 months." Are most dentists open to saying, "Yeah, absolutely"? Or is that still a new thing for them?
I think more and more dentists are becoming more open to that. There's an old myth like you don't go to your dentist while you're pregnant. False. There's another myth, you lose a tooth per pregnancy. False. Do more problems arise during pregnancy? Yeah. Are some doctors very scared to treat pregnant women? Yeah. They'd prefer not to treat them and I'll see you after you have your baby. But you're brushing and you're flossing and you're eating and you're chewing. So as a dentist, I don't want to be doing more work on the gums than the basic work that she's doing at home. I'm just going to do it more thoroughly and better. And I'm going to support her during this transition. So I'd say at the end of your first trimester, get a solid cleaning. Ideally, get your mouth checked before conception for any ticking bombs. Like, is there an infection? Is there a cavitation? Is there an infected root canal? Is there gum disease? How bad is the gum disease? So get that in check. Like the medical school students and the medical counterparts, they send us patients to clear them dentally when they're getting a heart transplant, when they're getting joint replacements. Why wouldn't they do the same if you're trying to conceive? To me, it makes sense, right? So there's a clearance, I think, for that as well. Obviously, you may conceive without planning to conceive, right? So then just support yourself during the first trimester as best as you can. It's a short period of time. Get a good cleaning at the end of your first trimester, and then get a good cleaning at the end of your second trimester, and make a plan with your doctor. And then at the end of the fourth trimester as well, that's another cleaning and that's another check.
So speaking of which, postpartum, does it change? Is it very similar in what you're doing? Now that your hormones have gone from really high because you're pregnant, you deliver, they drop back down. Maybe you're breastfeeding, maybe you're not. Maybe you're sort of breastfeeding and supplementing. But how does that next, again, the fourth trimester, how does all of that change, or does it in oral care?
This is such an important question because I find in the postpartum phase, what you eat and what you replenish yourself with is maybe more important than brushing and flossing. It's very, very important. The nutrients. So each one of our teeth is an organ. The status of our mouth and our teeth is very reflective of our body. So when a woman comes in with that many cavities, like 6 or 7 cavities in the postpartum phase, she's gone through major depletion. And that is impacting not just her teeth. It's impacting her mind. It's impacting her energy. It's impacting how she shows up. So in the postpartum phase, I always say, wait 3 months to visit your dentist unless there's an emergency. Hopefully there isn't. Get into the breastfeeding, get comfortable with the breastfeeding. But when you're breastfeeding another human, who is that human pulling everything out of? It's you. That's why replenishing is so important during this phase. Like very, very important. That's why I got consistent actually, because I was consistent for 2 weeks and I started feeling really good on a lot less sleep than normal. I'm like, huh. And then like it was just like mind-boggling that this is not overemphasized. So please, if you're in the postpartum phase, I couldn't take any vitamins, by the way, during my pregnancy. It would make me vomit right away. I would do all IVs. I had a great nurse that would come to the house because I was very depleted. But and then after 3 months, I got a solid cleaning. In my office, we use ozone. I don't use ozone on pregnant women. I use it on everyone else in general. I also, so we stain the plaque in your mouth and then we remove it. It's called guided biofilm removal. And it's wonderful because it shows you not only where you're not doing a good job brushing, but it shows you how old the plaque is. So it's really nice for the woman, first of all, to have that time for herself. When you're in the dental chair, this is another reason why I love working on women. Usually when they're in the dental chair, it's like a break from the world. They're at ease. Even if it's a stressful situation, they're at ease. So they're very motivated, especially when I tell them that your microbiome in this phase, you're passing that on to your baby. So they've had their baby for 3 months, they're breastfeeding or supplementing, whatever. They've managed to, that beautiful connection is fostering, and they want to protect this baby at all costs. So I go down and talk there. Like, you want to protect your baby, you want to give them a good microbiome. So let's do this. And they're very motivated. So that's for the postpartum. And then perimenopause and menopause, for them, it's more educating them because they've been through so much in life by then. There's a wisdom there, and they teach me more than I teach them. I love talking to my menopausal. Probably will be in perimenopause soon, but there you need to support them. So whatever symptom they have, you need to support. But also, I love for them to get blood tests, micronutrient testing, and hormonal tests. And I like to do the oral DNA for all my menopausal women, just to see, like, where are we? If you're going through dry mouth and you don't have that many dysbiotic bacteria, my thing with you is going to be different if you have high levels of dysbiotic bacteria to begin with. I'm going to bring you in every month if you have high levels of dysbiotic bacteria. I'm going to do the ozone. I'm going to do the great cleanings and then monitor you. And I'll give you some homework. For example, rinse with baking soda before you sleep. Let's focus on the nasal hygiene. Let's focus on mouth taping if possible. Because if you tape your mouth, you're forced to breathe through your nose and nasal breathe. And that will also help with the microbiome. So each scenario has its nuances, but the overall efforts is very similar.
And do you ever recommend oil pulling for the perimenopausal, postmenopausal women?
Yes, I do, because it lubricates the mouth. Have you ever had dry mouth?
Oh, of course.
It sucks because I had it during like the end of my pregnancy, and I'm still recovering. He's 7 months, but 8 months yesterday. I still have residual, like my hormones still haven't leveled. I'm breastfeeding. So the way I support myself, I rinse with baking soda. If I'm feeling extra dry, I drink a lot of alkaline water. So make sure I don't do carbonated beverages because it's acidic. So you got to think, if I have dry mouth, nothing is showering my teeth and my gums. They're very vulnerable to infection. So you got to do everything in your power to support them. So please don't drink carbonated water. If you insist, please drink it through a straw, okay? Just so it can bypass your teeth. Drink a lot of water. Drink electrolytes with your water. So I have electrolytes in 1 bottle of water. And that really helps with breastfeeding, by the way. Humongous help. I never breastfed my first 2 this long. And I made so many changes with that. But drink a lot of water. Oil pull, 10 to 15 minutes. There's ozonated coconut oil as well. So if I do your microbiome test and I see you have a lot of dysbiotic bacteria, I like for you to oil pull with ozonated coconut oil. Be very careful. I haven't talked about tongue scraping, but be very careful when you're tongue scraping if your mouth is dry, because it can cause you to actually cut yourself and your tongue to bleed. And really, really, really focus on self-care and self-love. and relax and take that bath and take that walk and foster a beautiful relationship with your dentist and medical provider, that time you need a lot of TLC. Like each one of these transitions, women need a lot of TLC. And that's what I've really focused on in my practice because like I'm one that needs it. Like I received it from my practitioners and it made a huge difference in the outcome of my pregnancy and my birth and my postpartum, having the right vibe.
Oh, I love that. That's such good advice. Rinsing with baking soda. How much baking soda do you use? And is it like oil pulling where you're swishing for 10 minutes or like a quick rinse?
Great question. Sorry. I should clarify. 1 teaspoon of baking soda to 10 to 12 ounces of water. Make it cute. Like put it next to your, sink. Make it accessible so that you can easily do it. And then you rinse like an oral rinse. Oh, and no rinses from the grocery store, like Listerine, Scope, Act. Please don't do that. If you're in any of these phases, well, period, don't do them at all, especially if they have alcohol. And be very mindful to essential oils in toothpaste and rinses because those are also, they can be drying. So that's why I like the salt water rinse or the baking soda rinse if you have a high dysbiotic bacteria or you're getting lots of decay, you're in the perimenopausal, menopausal age group. And then for the rinsing, you just rinse for like 30 to 60 seconds. So what I would do, for example, let me give you like a protocol for like one of my patients that I
Let's
did.
do that.
Okay, yeah. Let's do that. So she is perimenopausal. She's had like, I think 4 kids. So she's gone through a lot of hormonal fluctuations in her life. She's starting to get dry mouth. That's what brought her into me. And I was talking about dry mouth. We checked her teeth. She doesn't have any cavities, but she has a lot of inflammation in her gums. Okay. So we did an awesome cleaning with ozone. And this was her protocol. In the morning, the first thing she's going to do when she wakes up, she's not going to tongue scrape. Usually I have people tongue scrape. If her mouth is dry, she's not going to tongue scrape. She's going to rinse with baking soda water because when we sleep, we detox through our tongues. We sweat. There's a white layer a lot of times. And when you're sick, there's a lot more white than when you're not sick. And I'm having her floss and then brush before she starts her day. Before breakfast. Anyways, you should always be brushing before breakfast. You don't brush after breakfast or wait 30 minutes after breakfast. Then I'm having her do her thing. She likes to drink celery juice, have her breakfast. We're making her breakfast heavy in protein.
Always.
Very, very heavy in protein. She wasn't doing any protein. I could see it in her gums. And it was bad breath. It was dry mouth and bad breath what brought her in. Okay. And then at night, I'm having her floss. Then I'm having her rinse with baking soda again. Then I'm having her brush with a hydroxyapatite-based toothpaste. We're not doing, I don't believe in fluoride.
I was going to ask, of course. Yep.
No fluoride. If you feel like it helps you a lot, there's some people it helps. And I have a handful of patients that are still on fluoride toothpaste. And that's because there's something else that it's overcompensating for something else. And it's always the diet. So I have her brush with hydroxyapatite-based toothpaste and I have her floss again to get that hydroxyapatite in between her teeth because I'm trying to prevent cavities on her because she does have the dry mouth. Okay. I have her spend 5 minutes cleaning her nose, whether it's nasal hygiene and nasal rinsing or a nasal spray. So next to my bed, I have a nasal spray all the time. I spray my nose almost every single night. I spend some time cleaning my nose. After she can breathe properly through her nose, I have her mouth tape. So that way we have alkalized all the mucosa. We have flossed to get rid of any gunk before brushing. And we flossed again after brushing to put in hydroxyapatite goodness for the teeth. So not only are we protecting the teeth, we're also protecting the gums. And then we're shutting our mouth and going to bed. So I have her drink and this is also that helps my patients not snack a lot at night. I haven't even talked about snacking. Gosh, I can talk so after you do this routine, it's like 10 minutes. You're not going to ruin it by eating something. So do all your drinking, all your eating before, take your supplements. And then she's very new to oil pulling. So I'm sprinkling that in Like, you gotta not push people over the edge as well, right? So she's dabbling with it. We'll see how she is when I reevaluate her in a couple months. And I'm seeing her in 2 months.
Okay. And then the nasal spray with like a saline nasal spray. Let's say somebody doesn't want doesn't want to do a neti pot or something. I mean, a lot of people like it, but a lot of people don't.
So I say neti pot if you're congested. So if you're having allergies, if you're sick, if for whatever reason, while you're pregnant and you have pregnancy urinitis, use the neti pot. It's great. It's wonderful. It doesn't feel good, but use it. It helps a lot with your breathing. But if you're just in a day-to-day routine maintenance, no, just use nasal like saline. There's X-Clear that has a little bit of xylitol in it. There's the propolis one that has like beehive stuff in it. So there's a lot of, I use an oxygenated one, and then I like sniff it in. I like massage. I put some essential oils on my hands, opens up my sinuses, and I literally spend the time to clean my nose. And I think everybody should be doing that, but especially during these transitions. And imagine you do that after a nice magnesium bath.
You're going to sleep so well.
Exactly.
Now, what about the toothpaste? Hydroxyapatite might be a new one for people. Are there brands because that's a new type of toothpaste that's out. So I want to give people some options of like what.
Yeah, no, I love it. I'll give you a few options and I'll share with you what I use personally. So there's Risewell. They have, the reason I love Risewell is because they have an unflavored toothpaste. To this day, I don't like flavored toothpaste after this last pregnancy of mine. So your taste buds change and just a lot of things change, right? So you got to support yourself as you're changing. And also, one thing I've done a lot differently in this postpartum phase, I've like accepted and loved on my changes instead of trying to revert back to the way I was, because I'm not the same. I'm a new human with each birth. And I think with each transition, you're a new human. There's wisdom learned, there's hardships faced, there's traumas released. How can you be the same person? So support yourself. So I have a friend, she only uses strawberry toothpaste, strawberry flavored. So that's the only thing that she can use. So Risewell has an unflavored toothpaste that I love. There's also Fig, Feed Your Good Guys, made by two wonderful dentists, Dr. Stacy and Dr. Mark Brehenna. Risewell, I know one of the dentists that made it like very soulful humans. All these people are trying to make a dent in this massive industry. Those are my two favorites. But the key thing to look out for is hydroxyapatite. So if you're new to hydroxyapatite, go to the store, go online, and maybe buy a couple and see what you like and go from there.
I love that. I have the Feed Your Good Guys. I use that one. And then they don't have a travel one yet. So I use the Boca Travel because the little travel sizes are perfect.
Yes. Yeah. Boca is another good one. Sorry. Yeah, I forgot that one. I personally have never really used it, but I know they have very interesting flavors that some people really love. They have a good amount. Yes. They have like blueberry and ginger. I stay away from flavors and fragrances these days. Like I just, yeah.
I love it. Well, like I said, I normally use Fig, Feed Your Good Guys, but I haven't ever tried the Risewell, only because Dr. Stacy is a dear friend of mine. So
yeah, Stacy's amazing.
Gotta support.
Yes. The girls. No, we use her varnish in our clinic, and I highly recommend a Fig to all my patients.
Amazing. Oh my gosh, this has been chock full of information. I feel like I didn't even get to any of the like controversial type questions. We'll have to have you on for a part 2. But as we sort of wrap this up, I know people are going to have more questions and want to learn more. Where can they find you? Where can they learn from you?
So I am actively on Instagram at Dr. Leedia, Leedia. We're revamping our site. Hopefully soon we'll have a new interactive site that will have a ton of information. It's taking a while because I'm momming and doing that at the same time. Grace and ease are my words for the new year. Just to have, as women, we don't have a lot of grace for ourselves. So if you're listening to this is just have grace for yourself. So yeah, Dr. Leedia online, and we have our office here in Beverly Hills, and it's my brother and I. We both see patients, but right now, bless his heart, I love him to death. Thank God for him. I'm getting a proper maternity leave and he's seeing all the patients, and I'm supporting from the background.
Oh, that's fantastic. Well, thank you so much again.
Thank you
for coming on the Root Cause Medicine podcast.
Thank you.
I feel like oral health, mouth health is truly, truly, truly root cause. Like it's really forgotten. And it's really where a lot of this starts. So to have you on has just been like perfect, amazing.
Thank you. You're amazing. Thank you so much.